what I'm going to do here is use this facsimile of a skull, which means it's a very good copy of one, so it's not a really dead person. But what it's going to do is, it's very realistic. It'll show us where the muscles are, teeth, jaw joints, ear, and I'm just going to explain to you just a little bit on what goes on in a TMJ problem. So just for starters, this is this area over here. This is what's called a condyle, and which is the ball part of your ball and socket joint, which is in your jaw. So this is the condyle, and this fits into your skull, basically in a ball and socket type of relationship. Now the jaw joint isn't strictly a ball and socket joint, because you can actually move your jaw forward, so, protrude your jaw, move side to side, and every time you move it forward, it comes out of that socket. If you move it side to side, one side will come out of the socket. So for the most part, I'm going to be talking about the jaw joint in its more simple form, which is the ball and socket relationship. But all of the other movements are very much part of the problem here. You'll see where I'm going with this. So for starters, this is representing the muscles that power your jaws closed. In this case, these are some of the most, the masseter here is the biggest, most powerful. Then you have a temporalis, which I'll show you how that comes into play. There's other ones called the medial pterygoid, lateral pterygoid, etc. But the ones that I'll be focusing on are the bigger, the more important ones right now. So those are the muscles. As you can see, teeth are held into your face by a bone, which is no big surprise. That also comes into play with jaw joint issues. Now, perfect world, your jaws, as you come to close, just in the last little bit, they're in the socket, and it's designed that way to take a lot of force. And you can actually bite down and put a huge amount of force biting straight down like that. Now, you don't want to put a huge amount of force if your jaw is askew, like this, like that. I think that you would naturally feel into yourself that, yeah, that's odd. I don't think I should really do that, bite really hard like this. And there's a good reason for that, which I'll get to in a little bit. So ideally, what happens when you go to close is your teeth line up and close all the way around, which we call that centric occlusion, which is what you people know as, most people would know as, I'm biting down fully. And my teeth are interdigitating. That's my bite. Ideally, what happens is when those teeth come together and are fully closed, this condyle is seated in its socket position. Now that's the basis of all of these problems that we'll talk about here in a moment, is when those two situations do not happen at the same time. For example, your jaw is just closing and then you hit some other teeth prematurely, and in order to close all of the way, your jaw has to either slide forward or slide to the side, or just move that condyle out of its proper ball and socket position.